Valley Children's today. And we'll talk a little bit about new resources that we have for you all and upcoming dates to make sure we have these on your calendar. So with that, just a quick introduction and opportunity to call out some new people who we have on our call today. As you all know, if you've been involved in our coalition for a while, we have a website, our Central Valley eConsult Coalition website that has access to prior webinars, all materials that we provide as part of our group. And we like to be able to list all of those clinics and community organizations that are part of our coalition. So if we don't have you represented here, please take a moment. You can introduce yourself using the chat feature. We'd love to hear from you, make sure that we know all of the new people that we have on our call. So if you are on the chat, if you're able to use that to introduce yourself, feel free to go ahead and do that. If not, you're also welcome to unmute yourself and introduce yourself just to let us know that you're joining our call. So we are so glad to see that our coalition has grown. We started out with just maybe 5 or 6 clinics as part of this, and we have many, many more than that at this point, along with local hospitals and community organizations that are part of our coalition. So thanks so much for helping us grow our group. This group is made possible as from support from Anthem Blue Cross, Calviva, and HealthNet. So this is a collaborative and a unique effort that really does stand out among others across the country. People are watching our work, and it's great to see it grow over time. If you're not familiar with this process that we're talking about here, eConsult, if you're new to the whole idea of eConsult, what we like to talk about is offering eConsult as a first step for primary care providers in clinic settings to be able to more quickly access specialty referrals for their patients. So this is asynchronous communication between a primary care provider and specialist. This is not live telehealth, but it allows primary care providers and specialists to better treat their patients by potentially getting more quick advice or quicker advice for their patients. This is also an opportunity for primary care providers to decide what's best for their patients. So eConsult, as you know, is not for urgent requests, but for non-urgent, routine, non-procedural requests. So a great opportunity for primary care providers to keep those patients in their medical home, potentially reducing travel for their patients, making life easier for them. So we are glad to see this grow. And some of you have been doing this for about a year now. So it's great to have those of you on the call who are experienced. We'd love to have you pipe in during our call today and share your experiences as we discuss. And we have new folks joining on the call. If you've just jumped in and you want to introduce yourself, feel free to use the chat. I will admit we have a couple of people jumping on late because my link wasn't working. So thank you all for your patience once again. For those that are new to our coalition, just want to point out what we do as part of our work. We meet on a monthly basis as part of these roundtables, as you all know. Our goal is really to help clinics become aware that this is a service that's available for all Medi-Cal managed care patients. And as part of a recent grant from Anthem, this is also available to uninsured patients. We'll talk a little bit about that later today. As part of our work, we are really looking to help better support primary care providers that are doing e-consults. And since many of you have been following what's happening in California, we worked along with Senator Ana Caballero and others across the state to stand up a bill, State Bill 365, that made it all the way through many rounds of review at the state level, and unfortunately was vetoed. This was a bill to support primary care provider e-consults, and unfortunately did not pass this year, but we're hoping to reintroduce next year. We know it's also important to you to have access to e-consults for all payment types. So we're working toward having e-consult access for all patients. You as FQs, as community members, as plans have really demonstrated program leadership, and others are now following your lead and trying to do this similar collaborative effort across the state. And with that, we're able to show across multiple counties how e-consult has really impacted adoption and impacted specialty care in a positive way. So this coalition model is something we hope to share, and we're seeing get some great interests across the state. With that, I think I mentioned this briefly already. We may have Mary Renner of Central Valley Health Network on. We're so pleased that Central Valley Health Network has been so supportive of our efforts over time. And we heard loud and clear from many different clinics that uninsured access to e-consults was very important to make life easier for primary care providers. We want this not to be a barrier for primary care providers in being able to provide e-consults for any of their patients right now for Medi-Cal managed care patients or uninsured. So thank you for Anthem providing this grant funding to be able to stand up e-consults for uninsured patients, and for thanks to Central Valley Health Network for supporting this program, making it accessible to your clinics. I'm going to let ConfirmMed talk a little bit about how this works in the clinic setting. And before I do that, I'm not sure if Mary Renner's on with us today. I'm going to call on you later, Mary, to speak to this. But while we wait for Mary to jump on, Marianne McGuire from ConfirmMed will talk a little bit about how uninsured consults are accessible to patients and providers. Go ahead, Marianne.
Thank you so much, Libby. Hi, good morning, everyone. I am Marianne. I am from ConfirmMed. I oversee the strategy component of our team. And I wanted to just first thank the Anthem team for the grant, and for Mary Renner and her organization for working with us to administer the funding around it. So what we're doing in the Central Valley is we have, for the Medi-Cal patients, we have Anthem and we have HealthNet Calviva combined together to cover e-consults for all of the practices in the Central Valley. And with this grant, we now have the ability to also provide e-consults for uninsured. And just quickly, let me just define who that is, because that's the number one question that comes into our client team at ConfirmMed around the uninsured. What's meant by uninsured is truly patients that are seen that have no form of insurance. So it's not fee-for-service Medi-Cal, and it's not patients who have high deductibles plans off of the exchange. It's truly those with no insurance. And pretty much it works the same way any of your e-consults work. You just, the referral team is submitting an e-consult for the specialty that they need. And they're just basically, instead of saying, you know, it's an Anthem Sante patient, they're saying it is uninsured and it goes with the Anthem grant. And that's it. There's no change in process, works the same, e-consult comes back in the same, and there is no charges back to any of the practices in the Central Valley. We're using the Anthem Blue Cross grant for this. So Libby, why don't we just see if anyone has any questions that's from any of the practices while they're on. And they can either speak up or put it in the chat. And our team, Michelle Chapman's team at ConfirmMed, has gone out to all of the practices to tell them this began on November 1st. And next week, she'll be reminding the practices again to keep it going. We do have a few that have come in from the Central Valley last week.
Thank you so much, Marianne. Any questions from the group on how to access e-consults for uninsured? Once again, we are really so happy to have this sort of this barrier removed. So hoping to make this easier for primary care providers to be able to do e-consults for uninsured patients. We know patients without insurance most likely face the biggest barrier in terms of access to specialty care, longest waits, inability to get that specialty care that they need. So we hope that this can be a resource to improve access for you as FQs. And with that, please feel free to pipe in through the chat. Marianne, I think we're going to move on to sharing an example. We hear from you all, and as part of all across the Central Valley, that rheumatology is a specialty that is very challenging in terms of getting those referrals scheduled. So we thought we would call out and provide an example from ConfirmMed of how this can be done via e-consult. So Marianne, I'll leave it to you to speak to this.
Thank you, Libby. So in the Central Valley, we know that rheumatology is definitely a high need. We speak to practices all the time about this. We are recruiting our network of rheumatologists at ConfirmMed frequently to build it up. As well, across the country for ConfirmMed, we've done about 2,000 rheumatology consults just over the last year or so. And that's, you know, on top of the thousands of others we've done in the years past. So it is definitely an area that the primary cares ask for assistance. One, because of the access issue, right? It's really long waits. It's really hard to get out there, as well as there's some aspects in rheumatology that the e-consult cognitively really benefits the primary care. And what our team did was we kind of went through all of our rheumatology consults to get a sense of what are the primary cares asking the most about. And we did this as part of our initiative 2 years ago with HealthNet support to build the ConfirmMed ECHO process that many of the practices on the call participated in. And rheumatology was one of the leading attended ConfirmMed echoes. And from that, we knew what are the primary cares talking to us about? What do they need information in? So it really goes into 3 categories that we're really supporting consistently across the board in rheumatology questions. It has to do with the positive antibody tests. The primary cares get it back. You know, they have the patient presented with some of the common symptoms, you know, uni or bilateral joint pain, stiffness, morning issues, all of these parts, but they now have a positive antibody test. What do they do now? Is this a confirmed diagnosis or not? So what tends to happen is the e-consultant then can take a look at the medical record, looks at the labs, then is able to, number one, help reassure the primary care that, yeah, you know what, the likelihood of this being any of the rheumatologic diseases is low. That in itself is a really valuable piece of information for the primary care, as well as if the rheumatologist sees something in the chart, in the clinical presentation, as well as the labs, will then identify these are the next series of labs to have done to help narrow down this differential diagnosis. Very important for the primary care at that point. The next category of things that the primary carers are asking about is the diagnosis of rheumatoid arthritis, lupus, and psoriatic arthritis. And it's both getting to the diagnosis of that as well as how to begin to treat the patient. So the rheumatologists that do the e-consults really help with initiating the disease modifying anti-rheumatic drugs so that they can help the primary care identify what should be the first line of treatment here. And with that treatment, you as the primary care can be doing what in terms of labs, how frequently to see the patient, when to move to the next level, as well as adjusting the disease modifying agents that the patient may be on in the interim time until possibly a face-to-face should be called upon for that patient. And the rheumatologist will direct that. Also, really critical information, keeps the patient cared for in primary care until the face-to-face can take place in that situation. And lastly is just the the diagnosis of fibromyalgia and what else could it be if it's not that, to really help the primary care with the differential diagnosis there as well. So you can see this e-consult is actually one that it typically comes across. The primary care provides really good information in the consult note to the specialist about this patient, what they saw during the exam, what the patient's experiencing each day, what the labs are saying, what the radiology films were. And asking, and this is the last part, right? The second part of the consult. She has state insurance, Medi-Cal, and it's going to be a really long wait. You know, I think she has RA. What are some suggestions? This is a very typical consult that comes through. The consult note itself coming through from the PCP, this PCP did a really great job of driving the focused information to our specialist, to the rheumatologist, but the rheumatologist as well will go into the medical record, look at the labs, look at the radiology reports themselves to help build the consult back to the primary care. And here, what our rheumatologist is doing is addressing the labs and talking about what, between the labs and the symptoms, yep, I think we're landing on an RA diagnosis here. This is a good first line therapy treatment for you to begin, and things to be aware of around the use of methotrexate in rheumatology. You don't want to use it with somebody who's a heavy drinker, has some liver issues. And then the specialist is giving very concrete titration issues of how much of the drug to take and what should the patient take along with the drug in order to reduce some of the side effects around methotrexate. Then they recommend what monitoring should the PCP be doing, what frequency until they see the rheumatologist, recognizing the issue that rheumatology is a hard specialty to get access to in the Central Valley area. And then in the short term, if the patient's very uncomfortable, things aren't working fast enough with the methotrexate, try the prednisone taper and then walks through. Gives the PCP an option if they're not comfortable using methotrexate for another drug to try, but makes it clear it's not as optimal. So this is the piece that helps drive the knowledge base of the PCP in terms of, okay, I've gotten all of this, I see this, maybe the next time this presents, I'll feel a little bit more comfortable here in doing this. As well, the primary care has the option after they potentially start the patient to resubmit a consult back and talk about what's going on with the patient and if they need to do anything differently. And then from the specialist side, Libby, if you could go to the next slide, what really helps in terms of any e-consult, but speaking specifically to rheumatology here, is how to build a better response from the specialist can also what comes in from the primary care and in the medical record notes is really important. So in rheumatology, the things that, the specialist is looking for is joint pain and all of the variables that go along with it, duration, onset, location, as well as what are some other associated symptoms for the patient, helps narrow down the differential diagnosis. Relevant history that might lead to a closer diagnosis in the autoimmune area. And then, of course, labs and radiology reports. Most of the practices in the Central Valley do a really good job of getting in really solid medical record information to the specialists, as well as consult notes. So what we just continue to try to do at ConfirmMed is to build the knowledge around rheumatology. And as I stated when I began speaking, is we have the ConfirmMed Echo. We've done 2 rounds of rheumatology. The most recent was July of 2021. We had 4 sessions in there, and those are still all available for practices and primary cares to use. We have them in a library. Even though the session's over, the information is still there for them. And, 1 or 2 of them are just really very functionally helpful for newer primary cares coming in, like interpreting rheumatologic lab information, how to make sense of the joint pains that are being presented. So we always encourage the practices to use that resources there. HealthNet was, kind enough to support that, helped us fund that to build those echoes, and it's just a great resource. So I'm going to stop there and see if anyone has any questions or suggestions for us around rheumatology.
Thanks, Marianne. Super helpful.
Thanks,
And I think one thing we want to keep doing as part of our monthly roundtables is listening to clinics, listening to what specialties are of greatest interest, where we might want to see some examples of how this actually works. If there are specialties that we haven't seen or you as providers have not seen done as an e-consult, how does the conversation take place? I think it's really interesting to be able to see real world examples of how this is working. So thanks again, Marianne. And with that, want to bring in another example of how we're seeing e-consult work in practice. And I noticed, Petra Stambusho, we have you on today. I don't want to put you on the spot. I wanted to add this section as just a reminder. We've covered this on our past calls, but to remind the group that's on today that we now have access to the CAP program via both phone and e-consults, so both real-time and asynchronous. And Petra, I don't know if you want to say a few words. I did want to remind people that we still have the opportunity for clinics to enroll in CAP. So that's one reason I wanted to feature you all today. Do you want to say just a few words in terms of reminders on getting up and running on CAP? Petra?
Sure thing. We are really excited to launch the e-consult component. And this has been really an exciting next step in our progress. And we have enrolled a number of practices now in the Central Valley and would love to see how we can help make relationship with you and think through which cases might benefit from some consultation. We're also happy to host some CME events that could include something like a lunch and learn or just case-based discussion or on a specific topic of interest. So please share that readily with your providers and also see our website for upcoming webinars and educational programming. But please do consult with us.
Thank you. And I did want to add our link here, Petra. This link down below is the enrollment form, just a very brief survey to get involved in the CAP program. And what's great that is available now is the option to do CAP consults by both phone and e-consult, as Petra mentioned. This is Petra's picture. We have you featured here. We were planning to have our CME on behavioral and mental health this fall. We've actually pushed this out to January since we know how busy everyone is with regard to COVID response, still having clinics really all hands on deck in terms of the COVID response requirements. So we wanted to give everyone a little more time. So we're going to look to January to be able to provide this session, and we'll finalize our date. But while we're doing that, just want to be able to capture interest. So the link to the registration for the CME is here, and I'll put that in the chat so you all have that at the ready. And with that, we wanted to spend a little bit of time just talking about what our plans are for 2022. So those who are on the phone from clinics and community organizations, we wanted to note that this survey here is available to anyone who wants to participate from the community. This is just a way for us to very quickly capture some feedback from you all and where we're going to focus our energy in 2022. So this will come from me. It'll be an electronic gift card drawing that everyone who participates in the survey will have an opportunity to throw their name in the basket to be drawn for a $25 gift card. So just very briefly, what we want to be able to capture from the clinics is just the level of activity, how active clinics are, those topics that are of greatest interest. So whether we spend our time focusing on education, best practices, like we heard from ConfirmEd today on rheumatology, looking more at payment and reimbursement. Obviously, we've spent a lot of time talking around primary care reimbursement this year, and we're going to continue that work. Looking to expand e-consult coverage, not just Medi-Cal, managed care, and uninsured, but hoping that we will see expanded coverage for e-consult across all lines of business. Looking to, as we mentioned, the policy around e-consult support, not just policy, but having Medi-Cal support FQ payment, which is specific to a specific challenge in California that we want to be able to focus on. And I think you've all seen our dashboard of what we're looking at across the Central Valley and impact of e-consults across the 4 counties, being able to keep that dashboard updated so that you can use that to see how the e-consult is impacting care. We want to know from clinics what technology challenges they're facing, if there is any way to have some sort of technical support from us in addressing those challenges, and also looking at workflow and working with referral teams to make that process easier. So we'd love to hear priorities from clinics there. And then also just really tackling, like we did today, looking at rheumatology, trying to figure out which specialties may need the most help. Love to hear what priorities there are out there, who we should be reaching out to get more involved in our coalition, how we can help education and workflow wise, and really doing that direct outreach to be able to engage specialty providers in our group. So we hope that you can share this link with those who are part of your referral, who are your referral partners or who are your clinic contacts. So please do encourage those to participate in this survey. It's also in your email. So I'll put that in the chat in just a moment here. And with that, there are a few other links that we wanted to make available to you all. Some of you were able to join us for the eConsult Workgroup annual meeting. As you know, there are monthly educational opportunities as part of our California Healthcare Foundation funded project, the eConsult Workgroup. This is the link to the annual meeting. Many of you weren't able to sit on our full day meeting, so you can pick and choose which sessions you'd like to listen to. This video includes a great feature on Central Valley with our keynote speaker focusing on eConsult, which Dr. Joel Ramirez referred to as a technology lifeline. So that was featured as our keynote, moving on to having a presentation from Dr. Alanea Stevens of Chapaday Indian Health. So some great presentations along with policy discussion featuring Anthem and HealthNet discussing policy needs for the upcoming year. So take a look at those, that you can view the video and the presentations that are also in our newsletter if you want these links. So once again, just want to call out, I think you're all familiar with the benefits of eConsult to specialists. We encourage specialists to get involved and want to be able to connect our primary care clinics to our specialty or to their local specialty partners through eConsult. So we welcome those specialists to get involved in our group. And with that, I want to highlight one of our wonderful specialty partners that's on the call today. And Randy and Steve, I believe that you're on. I'll call on Randy first. We just want to thank you for getting up and running on eConsult as a specialty provider, Randy and Steve. It's great to have you on board, and we know that it's taken some work, and I know you've dug deep in terms of workflow and being able to get eConsult as incorporated into your provider's response. So it's been great to have you on board. And Randy, I'm not sure if you want to say a couple words around how your organization views eConsult.
Absolutely. Thank you, Libby. Hello, everyone. My name is Randy Guerrero. I'm the Director of Clinical Partnerships and Telemedicine at Valley Children's. And I believe my partner, Steve Cade, who's the Director of Business Development and ChildNet, is also on the call. And yes, certainly we have appreciated being part of the coalition and learning about eConsults. And yes, it's taken some time, but with some guidance and support from Libby and Marianne from ConfirmMed and many others, we finally launched our effort as pediatric subspecialty providers on the panel for ConfirmMed this week. We launched with a couple of pediatric subspecialties, gastroenterology and infectious disease. We're hoping to go live with endocrinology next week. And then we have cardiology, neurology, and pulmonology all on the docket to go live within the next couple of weeks. So we're not stopping there. We're hoping to engage more of our pediatric subspecialists in the process. We did conduct our 3 first eConsults this week, and all went really well. They were all GI requests, and our medical director, Dr. Al Young, managed them and was really very satisfied with the experience and happy to be able to provide the feedback to the primary care providers. We certainly have sought to support the management of more pediatric care in the local communities, closer to home for patients and families. And eConsults are just a wonderful tool toward that end. So we're excited about being able to participate on the coalition and also to work more closely with our primary care partners in managing pediatric care throughout our region. So thanks for the opportunity, Libby. And if Steve is on, he may decide to add or fill in anything that I missed.
Well, I think you've covered it very, very well, Randy. As Randy said, this was probably a year ago when we first saw the benefits of e-consults, and Randy and I were excited. We shared that. It's taken us several months to kind of get everything working, so we're kind of excited to be rolling it out now. We've got a lot of support on our IPA side. We have about 400 pediatric board certified specialists, so we know there's been a lot of interest locally to have those available to do e-consults, and so we look forward to rolling this out. Everybody's been very supportive. The doctors certainly see the value in it, not only from a primary care and from a patient perspective, but also from them as a specialist as well. So we're really glad, excited to be part of the coalition, and we look forward to growing and working with you. Thanks for the invitation.
Yes, thank you so much, Steve and Randy. And it's we love your input. It's really helpful to know from the specialty or specialist perspective how we might be able to be helpful as a coalition too. So a lot of the materials that we can provide, we've been really focused on how do primary care providers get up and running on e-consult, but we appreciate your input too on what we can do to make this easily understood by specialists. So thanks for continuing to provide feedback.
Yeah.
Great. So this, as you know, I mentioned resources for providers. I just copied in a good number of links into the chat, so you all have these at your fingertips. I know that's a lot of information here, but we want to make you aware that this is all available at econsultworkgroup.com also. So all of the resources that you as providers might want to be able to take a look at are here, including a playbook for how different organizations have incorporated e-consult into their workflow. Those who are on the plan side of the world, there are also playbook examples of what different plans have done to stand up their programs. So there are real world examples in addition to a good amount of research on pretty much any topic that you want to look at, whether it be policy, quality, efficiency, cost savings. We compile this research and keep it up on our website so that you can see the most recent information that's available to you all. With that, we'd love to hear your stories, whether it be what providers are experiencing, if you have an example of what has happened to improve a patient's care, if a patient had a situation that was improved dramatically through the use of e-consult. Those are the kinds of stories people want to hear. We met on our e-consult work group annual meeting, and that was the most resounding piece of feedback is how do we get patients involved in this? How do we hear how this impacts patients? And I think part of the challenge of e-consult is that patients often don't know that they got an e-consult. So that's what we are hoping providers can do, is to explain how this all works to patients. Often, if your visit's only 15 minutes, there's not a lot of time to do that. So how can we help primary care providers to make this part of their conversation with the patient? We'd love to be able to do that better. So just wanted to point out we have a good number of pieces of information in our chat here. Petra, thank you so much for standing up this program through connecting our providers to the UCSF Children's Hospital Oakland specialists. It's great to have you all involved and so supportive of us all. Petra's information is in the chat here. If you have any questions for Petra, they can be, she's offered to be able to respond to those offline too. And thank you, Petra, not only for highlighting the challenges of child psych need or the need for child psych access, but also noting that this is a stress for all ages. Having come out of such a challenging time over the past year, you in the Central Valley clinics have faced obviously the need to manage patient stress, mental health challenges through COVID. Those who've experienced other challenges like wildfire response, that is another layer of stress that people are experiencing. So we know people are coming through a time of loss. So we just hope that we can provide some resources to you all. And with that, I'm going to wrap up today and we had a lot of material, but we would love to have some questions before we end. So I want to open up for the opportunity for any Q&A from the group. So please do use the chat if you are shy and don't want to unmute yourself. But before I wrap up, I'm going to ask our planned sponsors to say a couple words and just sharing any feedback that they have. And Mark, if you don't mind, I'll call on you. Do you have any comments that you'd like to share?
Yeah, no, Libby, I continue to be really excited about this, the effort here, and just congratulate everybody that's been able to implement e-consult programs. We think it's the right thing for our members. We've invested in this and supported it through efforts and resource allocation for a number of years in partnership with ConfirmEd and Libby and Blue Path and others. So I'm glad that we're here. I'm glad that Anthem's at the table with us as a partner. If you haven't implemented and you're interested in implementing, please reach out to us. It's very quick. It's easy. We can do it within, a matter of at the least 1 month, but at the most 2 months. And it really doesn't require a lot of effort on the PPG, the clinical organization part. So, I encourage you to really think about it for the new year. It's really good for our members, and we really believe in it, the value that it brings our providers and our members. So thank you. Thanks everybody here on the call.
Thanks, Mark. Karina, do you have any words as we wrap up today?
Hi, everyone. Yeah, I just wanted to say that I'm really enthused with hearing, that Valley Children's is, starting to become a local specialty responder to e-consults. I think that's one of the things that has been really emphasized by a lot of the primary care providers, to just have that local support. So it's really exciting, and congrats. And thank you to everyone joining these calls and just continuing forward on this effort. So thank you so much.
Thank you, Karina and Mark. And as we wrap up today, those providers that are on, please keep this, please keep communications flowing our way. If you have recommendations for us in terms of resources that we could provide to be more effective and helpful for your clinics and your providers to better understand or better use eConsult, we want to be able to do that. And just as a reminder, in the chat, I copied a few different links. The first one is for CAP enrollments, getting up and running on the Child Psych Access portal program that Petra mentioned. Please do grab that link if your organization is not enrolled. That's a very quick enrollment process to be able to access the CAP consults. My quick survey, I swear it's a 5-minute survey to be able to get up and running and be effective in 2022. We want to be able to provide resources that are most helpful to clinics. And our eConsult workgroup video, you can click to the point in the video that is most interesting to you. As I mentioned, the clinic examples are right up in front, and the presentation on policy is in the middle of the video from Anthem and HealthNet. And last, interest in January CME, it's a free opportunity for providers and community members to learn a little bit about behavioral mental health. And last, I hope that we can encourage everyone at the clinic level to think about eConsult as a potential for getting access to care for uninsured patients. It's a great tool, and it's great that we have the opportunity to extend this to uninsured and not just our Medi-Cal managed care patients. And I see Mary Renner is on. I just wanted to thank you, Mary, for helping us with this program and getting the word out. Mary, leading Central Valley Health Network, has been such a great proponent, gathering FQHCs and getting the word out about eConsult. And Mary, I don't want to put you on the spot, but I know you just jumped on. I'm just wondering if you had any comments that you wanted to share with us and where we might focus our energy in 2022.
Thanks for giving me the opportunity. I would just like to say thank you to Anthem for this, for the generous contribution to make the eConsults for the uninsured available. And I know that we have formalized things, I think, with ConfirmEd and with Anthem. So, we're ready to go with that process in terms of making sure behind the scenes, I think that that can all happen from a payment perspective. So we're just very excited to be able to support this effort. And like you said, I've been a long time proponent of this and been waiting for probably 8 or 9 years to bring eConsults to the Valley. So I'm just very excited. So thank you.
Thanks again for your support, Mary. And as you continue to meet with CVHN members, we hope that we can share the success of the program and how it's growing with your group. Okay, everyone. Well, thank you for your time today. And thanks also for spreading the word on these opportunities to gather information. So capture those links in the chat before you go today, or go back to your email if you want to pull them out of the newsletter that we've included all this information, so you can have that too. Okay, thanks everyone. Have a great day.